Today, we need to talk about something that will impact every retiree and every soon-to-be retiree in 2026. CMS has officially released the 2026 Medicare Part A, Part B, and Part D premiums, deductibles, and income-related adjustment amounts. These changes affect your healthcare cost and your retirement budget, so it's important to understand what's coming. Let's start with why this matters. If you're retired, unexpected healthcare costs are one of the biggest threats to your financial stability. And what most retirees don't realize is that Medicare costs change every single year. The numbers for 2026 are bringing increases across the board, and some of them are significant. So let's walk through what these changes actually mean in real terms. First, Medicare Part A. Part A covers inpatient hospital care, skilled nursing facilities, hospice, and some home health services. The Part A hospital deductible is increasing from $1,676 in 2025 to $1,736 in 2026. That's a $60 increase just to be admitted to the hospital. Hospital coinsurance is also going up. For days 61 through 90, the cost will be $434 per day, up from $419. Lifetime reserve days are increasing to $868 per day, up from $838. And if you need skilled nursing care, the daily coinsurance for days 21 through 100 will be $217, up from $209.50. Most retirees do not pay a Part A premium, but for those who do, because they don't have enough work credits, those premiums are also rising. The reduced Part A premium will be $311 per month, and the full premium will be $565 per month. Now let's talk about Medicare Part B, which covers doctor visits, outpatient care, durable medical equipment, and more. The standard B premium is increasing from $185 in 2025 to $202.90 in 2026. That's a $17.90 increase each month. The annual Part B deductible is also increasing, moving from $257 up to $283. These increases may seem small individually, but over a year, especially for couples, they add up quickly. CMS says these changes are driven by higher expected utilization and pricing adjustments. They also noted that without recent administrative action to reduce overspending on skin substitutes, the premium would have been about $11 higher. If you're someone who only keeps Part B to cover immunosuppressive drugs after a kidney transplant, your 2026 premium will be $121.60. Now, let's move into high-income retirees because IRMAA, the income-related monthly adjustment amount, will impact roughly 8% of Medicare beneficiaries. In 2026, retirees with higher incomes will pay more for both Part B and Part D. For example, if your income is below $109,000 as an individual, you'll pay the standard $202.90. But once your income moves above that threshold, the premiums climb quickly. At incomes between $109,000 and $137,000, the premium jumps to $284.10. Between $137,000 and $171,000, it increases to $405.80. Between $171,000 and $205,000, the premium rises to $527.50. Between $205,000 and $500,000, it becomes $649.20. And at incomes above $500,000, the premium is $689.90. If you're married and filing separately, the brackets are even more aggressive. For Part B, immunosuppressive only coverage, the IRMAA amounts scale similarly, but the dollar figures are slightly lower. Now let's talk Part D. Part D plan premiums vary based on your plan, but high-income retirees will pay an additional amount directly to Medicare. In 2026, individuals with income under $109,000 pay no IRMAA for Part D. But once income goes above that, the numbers rise. At income between $109,000 and $137,000, the IRMAA amount is $14.50. At $137,000 to $171,000, it's $37.50. At $171,000 to $205,000, it's $60.40. At $205,000 to $500,000, it's $83.30. And above $500,000, it's $91. For married couples filing separately, the IRMAA amounts are $83.30 or $91, depending on income. So what should retirees do now? First, review your 2026 budget. These Medicare increases may add several $100s to your yearly expenses, and more if you're in an IRMAA bracket. Second, if your income is close to an IRMAA threshold, consider doing some planning. Even a small increase in income can trigger significantly higher Medicare premiums. Third, review your Part D and Medicare Advantage plans during open enrollment. Plan premiums change independently of CMS. And finally, if you're retiring in 2026, don't assume your cost will match what a friend or family member is paying today. Your premiums and deductibles will be higher. If you found this breakdown helpful, please like the video, subscribe to the channel, and turn on notifications so you never miss an update that impacts your retirement. And let me know in the comments, do these Medicare increases change your retirement budget? Thanks for watching, and I'll see you in the next video.